god, that's Angel. Just kidding. So my name is Nur Ainsyah Arif, and this is my video presentation. Please don't forget to enjoy. So hi, and my name is Nur Ainsyah Arif, and my metric number is 320412211012. So today I will answer some questions based on the case study. So let's go. So the first question is, describe each procedure, procurement, purchasing and receipt injection morphine. Explain in the diagram and the each procedure, each process. So the first one is procurement item. It shall be made upon request from the requesting unit and approved by the head of department when the stock availability is low at store. So next is the purchase. When prepare purchase order, pharmacists should follow the following information, which are name of company, approved supplier, date of purchase, description of item, quantity and pack, size and unit of measurement of item to purchase price of item, sign the PO, which is a purchase order. Morphine is a dangerous drug, so that all the above that would be done by the pharmacist. And the last one is receipt injection morphine. When receive the stock or morphine, pharmacists must identify the name of drug, quantity and pack size versus unit of measurement, expiry date and batch number, and the delivery condition. If a non-conformant is found upon checking the item received, inform the suppliers such as wrong item, wrong quantity, shortage and excess, damaged goods, expired batch, open acceptance for dangerous drug. Pharmacists should check item and place in the designated locked storage area and enter receiving data into the dangerous drug bulk stock record book. Next, I will explain what the action taken if the store receives COVID-19 vaccine near expired dates. First one is all items with an expired date less than 1 year from date of receipt shall be accompanied by a letter of undertaking from the supplier to facilitate replacement upon expiry. For the second one, if urgently required item with near expired shall be accepted if the item order is administered or used immediately. For the next question, explain the drug separation of drug type and give 2 example drugs. So the first one we have general, which is the drug to be arranged alphabetically in cabinet or as per use as antibiotic, antihypertensive and many more. The second one is short expired stock to be placed in front and long expired ones at the back with FEFO or FIFO method to be followed. The next point is drugs must be protected from the moisture and to be stored in the normal humidity at room temperature. Next is to protect from direct light. Drugs should be stored in a light resistant cupboard or drawer. Expired drugs are to be disposed according to regulatory requirement. The example drug for general storage is paracetamol, Diflam, oral spray, and Breville cough syrup. For cold chain, the room to be air conditioned with temperature control facility. Drugs like vaccines, serum, and hormones to be stored at 20 to 18 Celsius in refrigerator, freezer, or cooler room according to the recommended storage condition. For the temperature monitoring through dye thermometer with temperature charting or other suitable device. Cold storage facility must be supported by emergency power generation in case of power failures. The example drug for cold chain storage are glaucoma eye drops, insulin, and vaccines such as Sinovac and Pfizer. So for the next one is inflammable drug. So what is inflammable drug? Inflammable drug is the item like ethanol, methanol, acetone. Snail should be kept in store with at least 10 feet distance away from other injected body. The location and design should ensure maximum air circulation to avoid concentration of fumes or gas. Adequate ventilation should be provided and spark-proof switch should be located outside the room. The example of inflammable drug are alcohol, kerosene, benzene, and hydrochloric acid. So for the last one is dangerous drug. Dangerous drugs should be separate from other drugs like controlled substance must be stored in a double lock cabinet when it's fastened to the walls. The key to this drug safe must be kept in a secure place away from the drug storage safe under the responsibility of the pharmacist. Proper records need to be maintained for the dangerous drug. The example of the dangerous drug narcotic drugs such as morphine, pethidine, barbiturates. So the last question is briefly explain its procedure of distribution of drug in hospital below. So how can we define TTA? When a patient is ready to be discharged, the doctor will write all the discharge medicine in the prescription slip, and all discharge prescription should be initialed by the pharmacist, prepared and counter-checked by another pharmacist. Describe the procedure and detail when screening TTA prescription. So when you screening the TTA prescription, it should have patient names and address because it helps to provide medication to the right person. Secondly, prescriber names and signature should be mentioned in the prescription because if there are any problems with the prescription, pharmacist can verify with prescriber. And thirdly, dates of the prescription generic must be mentioned in the TTA prescription because it's easy to monitor the patient's drug history, and moreover, name of drug, its availability, doses of drug, and its route of administration also must be mentioned on TTA prescription. And the last one is prescription should also have durations and validity of the drug, such as its expiry dates and when we need to consume the medications. Define about pre-packaging what supply. Pre-packaging what supplies means the act of placing small pre-counted quantity of drug product in containers and is suitable for dispensing or administering by the patient's prescription or order. Next, the question is describe the procedure for pre-packaging. What supply? The appropriate medication must be selected and detailed check include the drug name, strength, form, appropriate direction, and expiry date. Patient name and date of dispensing must be complete on the label in indelible ink on prepack for product. Any dosage instruction to be added in the length of course, such as take one tablet once daily for 5 days. All medication must be independently checked against prescription or record for the accuracy by a second qualified person. What prepack register must be complete at time of dispensing and must be include date of supply, patient full name and number of bag supply.
The register must be signed by both the qualified practitioner supplying the medication and person performing an independent check. If a prepack is issued in error or medication is stopped, it must be reissued for another patient. Cross out the patient name and use on the ward as a issue for another patient. Cross out the patient name and use on the ward as a ward stock. The running balance must be checked at each dispensing. Discrepancy must be reported to pharmacy staff and an incident from complete within 24 hours. The outpatient prescription or copy of discharge letter in the pharmacy file for collection by pharmacy personnel at the next top-up. The chemotherapy prescription file, the drug chart in the medical notes. Pharmacy staff will supply the quantity again complete discharge letter when stopped up.